My name's Duncan Williams and I'm the chairman of a company called IA Technology based in Hereford. Besides a lot of the many things we do for the Ministry of Defence and Halliburton, Martin Baker, we do ejector seat technology, we do video technology, and we do equipment for the police. But part of our product portfolio is a product called SenseTech. SenseTech is a product that has been designed in cooperation with people who are psychotherapists and people who are involved in post-traumatic strain disorder conditions, and this product is very much an aid to help these clinicians with the technique called EMDR. Today I've got a gentleman with me, Dr. Farrell, who's going to run through a few how we use it, how to use it practically, how it will aid you to be a more of an effective or indeed help you with psychotherapy process using EMDR, and more importantly it's a bit of a layman's guide how to use our equipment and what the benefits are. So I'm now going to talk to Dr. Farrell. So Dr. Farrell, thanks very much. Now, this is a video, as we said earlier, to help people, help those professional clinicians and psychotherapists. What actually is PTSD?
Well, PTSD is a condition that people experience when they have had a trauma. The problem is the fact that after a trauma, the brain is almost like sort of bombarded with lots of experiences that in some ways it has the skills and the ability to know how to deal with that, and sometimes it doesn't. And what happens is the fact that the way in which the brain processes that information sometimes gets blocked, and it can create a sense of disturbance, or it can create symptoms like sort of re-experiencing, or in terms of flashbacks, or it can start to make people feel very anxious. So the more extreme form of this is a mental health condition known as post-traumatic stress disorder. Now, this as a condition is something we've known about for a very long time, but we've only called it post-traumatic stress disorder since around about 1980, in the aftermath of the Vietnam-American War. And since then, psychiatry and psychology has really been looking for what are some of the most effective ways of helping those types of people. And this is what brings us then to EMDR, because in the late 1980s there was a particular therapy that was developed by an American psychologist called Francine Shapiro. And she stumbled across a phenomenon that occurs, which is that when people are thinking about a memory that is uncomfortable, or a memory that bothers them, is the fact that if you subject that memory to a form of bilateral stimulation, that somehow it seems to jumpstart the brain and allow the brain to help process that information more effectively. So on one level it was as simple as that. Since then what's happened is the fact that we've got a much better understanding of the therapy, we've got a much better understanding of what's going on in the brain, and there's now a lot of evidence to support the fact that actually EMDR is a very effective treatment for clients that have post-traumatic stress disorder.